Welcome to LFPL's At the Library series, an ongoing podcast featuring author talks, programs, and events at the Louisville Free Public Library. For more information about upcoming events, visit us online at www.lfpl.org/upcoming-events.htm.
So without further ado, I would like to introduce our presenter for this evening, Dr. Robert Friedland. He is a neurologist and the Rudd Endowed Professor of Neurology and Neurobiology at the University of Louisville School of Medicine. He previously worked at the University of California, Berkeley, the U.S. National Institute on Aging, and Case Western Reserve University. Recently, his research has uncovered a key role of intestinal bacteria in the initiation and progression of Alzheimer's disease, Parkinson's disease, and amyotrophic lateral sclerosis. His studies of humans and animals in the United States, Japan, and the Middle East and Kenya have helped to advance the concept that the risk of aging-related brain diseases can be lowered through our personal actions, which is why I imagine we're all here. So please, if you would, give a hand to Dr. Robert Friedland.
Thank you very much, Tony, and thank you, everyone. Is it too loud? Thank you, everybody. Thank you, everybody, for coming. I'd like you to consider the possibility that this ship is a metaphor for aging. That when we get older, our ship loses some sails, maybe is a little bit less balanced, is missing some ballast on the bottom of the ship, and maybe some of the people controlling the sails are not working as well as they were before. And of course, it's a question, what can be done so that we have the healthiest aging? So what could be help preserve the function of the ship? The function would be dependent on many things, not only the sails, but the sailors, the paddles, the rudder, the steering wheel. And it turns out there are many things we can do concerning the quality of our aging. So I'd like to present my context, or rather how to consider aging. I think it's a new attitude from talking to many people. My approach is a different way to view aging. And I'm grateful for Tony Dingman of the library and for Carmichael for being here and bringing the book. I'm particularly thankful to Pamela Reichelt, Shannon Jupin, and Kathy Bays, our nurses and nurse practitioners, for many years of teaching and for sharing their wisdom with me. I'm also acknowledge the contribution of my collaborators in Louisville and in Japan and the United Kingdom. Although the ideas or suggestions I make in the book are mine alone. And I'm grateful for the support I've received from these foundations and agencies, from the United States government and the Japanese. Particularly relevant, maybe the Japanese supported a one-year sabbatical leave in Japan, during which I wrote this book. I'm a geriatric behavioral cognitive neurologist, which means I see patients who are mostly over 65, but not entirely. They mostly have memory problems, but they also may have problems with language, judgment, finding their way around, behavior, and movement and stability. And the question is, what can we do to be prepared for aging? Does aging happen to everyone? What happens when we get older? When you consider what I'm going to say, I recommend that everyone discuss any changes with their lifestyle activities with their doctor. And what I did in this book was to take everything I've learned in the last 45 years of this practice, seeing patients with these problems. What would I say if I had 2 hours, 2 weeks to talk to them about what I recommend, rather than maybe 15 minutes or 10 minutes or 20 minutes? What would I say to their children who are notably or reasonably concerned about what their parent is experiencing, and what if it happens to them? What would I say? So I've put this in this book in an initial section about the background, and then in applications concerning what should be done. My key point, or a key point. The first key point is aging is not inevitable. You may think that, well, everybody gets older, but that's not really true. And I have 3 goals of aging, which are very important in framing your approach to aging. And finally, everything about aging can be better understood from the context of evolution. What was life like for our ancestors? Because we are not genetically equipped for life in the 21st century. We're genetically equipped for life 5,000 years ago or 10,000 years ago, because that was when these genes we have were being chosen by natural selection. And I'll talk about that. The 3 key words right away would be attention, attitude, opportunity. What do we pay attention to? Attention is a key component of memory. It's hard to remember something if you didn't pay attention to it when it happened. When you go to bed, are you paying attention primarily to the fact that there's a catastrophe in Zanzibar and 30 children have died? That's a tragedy, but paying attention to it is not really going to help those children. What is our attitude toward aging? Is our attitude, well, I have this pain in my knee. I can't go upstairs like I used to. Regretting, worrying, anxiety, and stress. Or do you view this and our survival as an opportunity, which is not shared with everyone? And of course, next, what are the practical steps that you can do? Consider these 2 patients. A 94-year-old man who said, he came to see me for 3 years. Every year he said, I have Alzheimer's disease. I always say, what's your main trouble? I have Alzheimer's disease. Why do you think you had Alzheimer's disease? He said, well, I can't remember who wrote The Red and the Black. For those of you who don't know, it was written by a French author named Stendhal, who had no first name, but it's really not important. Right? So if you forget who wrote, Tale of Two Cities, it's not. Maybe if you teach French, if you teach Dickens, Dickens is yours, you got a PhD in Dickens, maybe you should remember that. But if you don't have a PhD in Dickens, it's not important. Forgetting is a function of the brain. We couldn't remember anything if we didn't have a very, very good system for forgetting. You can't remember where you parked your car today if you don't forget where you parked it yesterday. So he complained that his knees hurt when he walked up the stairs to his office, 4 flights. I said, you're still working? I told him only 8% of men who were born 94 years ago are still alive. So rather than him having his daily life an opportunity to complain and regret and say, I can't do this, I can't do that, I said, well, why don't you take the elevator? Not only are most of his age companions, they're dead. Also, if we had 100 of them, if we had 100 94-year-old men in a room, or theoretically, right, half of them would be in a nursing home. So the fact that he's not living in an institution is extraordinary. The fact that he still has a job and he still has an office. I mean, you wouldn't find 1 out of 100 94-year-olds who still have that. So from the perspective of this added perspective, I hope it helps him to appreciate his survival. Secondly, this man, who actually was a patient's husband, he came in with a cut-off shirt so I could see his muscles and his barbed wire tattoos and his motorcycle T-shirt. I said, do you ride a motorcycle with your wife, my patient? He said, yes. Do you wear a helmet? Oh, no. Why don't you wear a helmet? When you're going to go, you're going to go. I said, all right, then, well, when you cross the street, do you look both ways or do you figure, like, well, look, when you're going to go, you're going to go. Why should I waste my time looking both ways? It's really irrational, but a lot of people, even I know friends of mine, they have a PhD or they're surgeon or something, they figure, well, I'm 76. I won't live forever. I'm not afraid of dying. I might as well eat badly because I enjoy eating badly. It's similar. It's a similar thing to you. When you're going to go, you're going to go. But the truth is, how you go, when you go, depends on what you're doing. There are some things you can't change. So if you have a causative gene which makes you have a disease, that's very difficult, in some cases impossible to fix. But that's not common. And it's not only the genes. So I'm going to talk about what happens with aging, why it matters. And the theory that I come up with, I call it the theory of the multiple reserves. 4 reserves which are cognitive, physical, psychological, and social, which help to preserve our function as we get older, and what we can do about it. It's important to understand we don't want normal aging, because normal means usual or expected pattern. And most people over 65 have 2 or more chronic diseases, like hypertension, osteoporosis, emphysema, and kidney problems, and so on. Most people who are over 65 are not in perfect condition. So our goal is not to be sick like the average 65-year-old. We want exceptional aging. So everything declines with aging, except one thing. This chart shows how blood flow to the heart and kidney and nerve conduction and breathing capacity, everything is going down as you get older. And the truth is, this is not a disease. This doesn't happen to everyone. And it doesn't necessarily interfere with your function, this kind of decline. Of course, if you're a professional marathon runner, when you get to be 50, you're not going to run as fast as when you were 30. That's the case. But it doesn't interfere with most of our functions, even though this is declining. What does increase is this variability. This is the values of walking speed at 80. Look, it goes from here to there. And younger people are more similar to each other. Older people are always more different. So variability of anything you want to measure, variability will increase with aging. What this means is there are a lot of people up here who are doing very well, even though the average for the population is falling. So it's possible to maintain function when you get older. It's not something which happens to every person. This is key. But as everything falls, everything declines in function, the balance of the body, which is called homeostasis, is more delicate. So the heart function is declined, the kidney function, and the lung function, the immune system function is less skillful in an 80-year-old than a 50-year-old. But this means the balance of function is more delicate. It doesn't mean it's impaired, but it's more delicate. So if something happens, you're more likely to be affected by it. My example is, when I was 12, I had a sore throat. I had a streptococcal pharyngitis. I had a fever of 104, and I felt horrible. I had a lot of pain, but I was not hallucinating or delusional. But if I was 85 and I had the same kind of infection, I probably couldn't generate such a high fever. But an 85-year-old with the same infection as I had when I was 12 might be delirious or hallucinating or certainly not able to do calculations or know where they were. Not because they were sicker in their throat, but because their reserve capacity, their resilience, their homeostasis was more delicate. And that declines with age. The purpose of the 4 reserves, the 4 multiple reserves, is to enhance our balance of the systems so that when something happens, everything is better able to help us overcome it. This is accentuated by this word, salutogenesis. So pathogenesis is how we get sick, and salutogenesis is how we become healthy. So it's an active process. Health is not only the absence of disease, and this is a function of interdependence. I wanted to call the title of this book, I wanted to call it The Declaration of Interdependence. But everybody I met said that's too complicated, and it's not clear what I'm talking about. But this is the most important one of the most important principles or ideas about aging. Everything is dependent upon everything else. It's not only the brain with the heart, it's the heart with the liver, and the liver with the intestines, and the gut bacteria, which I'm going to talk about. I've asked many people this question: is aging inevitable? Most people respond and say, yes, of course, everybody gets older. But no. When I was a neurology resident, I had 4 friends who were studying with me who had AIDS in the 1980s, and they all died. They were my age. They're not my age anymore because they died in their 30s in the 1980s. They didn't get to be old. They didn't get to be 40. But everybody here knows people like that in your family or friends, people who tragically died before they got to be old. 14% of people in the United States don't live long enough to become 65. And of course, there are people who die before they're 60, 50, 40 in childhood. So many examples could be used. Aging doesn't happen to everyone. We could say John Kennedy Jr. or many, many other people, particularly Diana may be the best example. She died when she was 36. So the relevance to this is if I feel upset because my tennis is impaired by my left ankle, my right wrist, my left elbow, and my hip, I shouldn't feel too upset. If my friends who had died in their 30s could hear me complaining about not being able to play tennis with the same talent or ability, right? They would be, what are you talking about? They wished they could have pain. They would wish they could experience bad weather and a weak second serve and so on. So aging is not inevitable. Not only it not happen to everyone, the declines with aging do not happen with everyone. So it's possible for a 50-year-old who eats too much, is overweight, drinks too much, and smokes, who has impaired cardiac and lung function. It's possible if that person improves his lifestyle behaviors in the next 10 years, so when he's 50, he's better. He can exercise more, his brain will work better, and his liver function, his lung function could improve. So the declines we saw in the other slide, it's about a population. It's not about everyone. And what determines where you are in that perspective about getting better, staying the same, or getting worse when you get older, it depends on what you do. It's not when you're going to go, you're going to go. That's not the right attitude. Everyone is one day older today than they were yesterday. Everyone is not one day older tomorrow than they are today, because some people don't survive the evening. My Uncle David died one night. His wife woke up in there. He was 56. He was gone. I don't know why, but the survival is not guaranteed. Because aging is not inevitable, it's an opportunity. This is maybe my key concept. Because it's an opportunity, it's important how we handle the opportunity. If we think, well, I'm getting older, I'm degenerating, I'm losing this function, that function, that I might as well eat too much, I might as well smoke, because after all, I'm going to die. It is an opportunity that many people don't have. So it needs to be treasured. It's a wonderful thing that we have this opportunity, that those of us who are here have an opportunity. There are a lot of myths about aging, which could be a talk on its own. But even this great physician, William Osler, said that when men get to be 40, they're pretty much over the hill. This was like in the year 1900. He was a professor at Johns Hopkins at Oxford, and he's wrong. But this is an old, very old view. When I was a student, it was believed that if a 70-year-old person had trouble with their memory, well, what do you expect? They're 70 years, that's called senility. That word is now obsolete. It should never be used. It's not true that it happens to everybody. It needs to be evaluated. It's an incorrect view. Charles Dickens wrote this book when he was 73, 72. So there are many examples. Monteverdi wrote an opera when he was 75. Old people can do wonderful things. So there's no age at which learning has to stop. Because it is an opportunity, I think it's best to view this in regard to 3 goals. The first goal is easy. Everyone could agree that not dying is a good goal, right? So you want to be here one day, 1 year, one day to another, 1 year to, you want to be alive. Okay, we got that. The next one, we don't want to be sick. That's good. We don't want to have cancer. We don't want to have chronic obstructive pulmonary disease. We don't want to have coronary artery disease. That's good. But that is not enough. Many people are finished with those 2 goals. So if they are 70, and obviously they're still alive, right, and they don't have cancer and they don't have heart disease, they figure, well, that's enough. Well, why should I exercise? Why should I eat well? Because I'm in good shape, right? But the third goal, which requires their attention, is to be fit. And I don't mean this only in the context of, your heart can allow you to walk 2 miles. That's good, but that's not enough. I will present 4 aspects of this fitness: cognitive, physical, psychological, and social, which I call reserves because they provide us with resilience. And what's important for everybody is you want to have your fitness at the highest level, so when things happen, you'll survive it, or you'll do well with it. So imagine 2 people, 80 years old, 2 80-year-old women fall and break their hip and go to the hospital and get pneumonia. One dies and the other doesn't. It's not only because of the bacteria. It could be that one has a worse bacteria than the other. It could be because, one had such low resilience because she already had 50% diminished lung function, or her liver was already damaged by too much drinking, or she was 100 pounds overweight, or she had hypertension which she didn't treat. That's why she died. So our goal needs to be surviving and not having disease, but also being fit in this manner of multifaceted resilience. People will often say, or many people, including people in my family, have said, well, what does it matter? Or, oh, my mother lived to be 90, so I'm in good shape. It matters out of consideration in evolution, and that this is, we must know that we're not made to live this long. For most of human history, everybody died when they were 20, or, in children, if they survived childhood, they died when they were 20 to 30, maybe 40. I mean, there were older people. Our evidence shows there were old people, but not many, not like now. The only time in human history when many, many people live to be over 60 is now. In Japan, the largest age group are people over 50 to 60. That has never happened before. But what this means is evolution has not had an opportunity to assist us in having a long life. Because evolution is concerned with the survival of our genes, and it doesn't help our genes to live to be 50 if we get to be 40, or if we die when we're 45. It doesn't matter. I'm not commenting about the value of grandparents. That's another matter. But for genetically, for genes, I think it helps for older persons, by which I mean anyone over 50. It helps to know that we're not made to live this long. So young men can play American football. I'll get to that later, but okay, they play American football. They smash each other and destroy each other, and then they get up and imagine a team of men 75 years old playing American football. There'd be a stretcher on the field after every play, and there'd be a line of ambulances waiting to, it wouldn't work. Then genetics are not everything. Only 1% of Alzheimer's cases are caused by genes. Genes are involved in the risk, but they do not cause it. In the other 99%. It's good to have old relatives, but it's not guaranteed. And very interesting, the risk of Alzheimer's disease is declining in Asia, North America, and Europe, correcting for the fact that there are more old people. And why is that? It can't be because of the genes, because the genes can't change in a population so quickly. But in the past 20 years, the risk has declined 20%. That's because people are healthier now than before. There's much less smoking, there's better control of hypertension, and there's less Alzheimer's disease. This is evidence that it matters what you do. Personally speaking, I'm upset, but it's true that I used to eat pastrami and corned beef sandwiches, and now I can't imagine, eating, even looking at a pastrami sandwich. But where people are eating better than that before, but not everybody, of course. And protective factors can not only prevent disease, but can delay the onset. This is an important concept because Alzheimer's takes 20 years or more to develop in the brain. So if it can be slowed because you do the right thing, which I'll talk about in a moment, maybe it won't affect you because it won't affect you till you're 90 and you might not live to be 85. That's life. So you want to do something to delay it. You want to stop it if you can, but if you can delay it, that also maybe make the big difference. All these things involving stroke, heart disease, Alzheimer's, Parkinson's, and ALS involves the immune system. And immune system mechanisms in people, and everybody here, you can change how they're balanced. And I'll tell you how. And you don't need to get monoclonal antibody therapy. And we're not protected by evolution because there hasn't been a time when so many old people were around. Because of this, we have to consider the effect of lifestyle choices on these reserves. Even if you have Alzheimer's risk genes, your risk is higher, but you still may live to be 90 and never get it. And even if you don't have Alzheimer's risk genes, you still may get it. So I don't recommend being tested for that, although maybe in some situations it's helpful, but not usually. It can cause unnecessary worry. I call this the theory of the multiple reserves, just like maybe the germ theory of disease or the theory of evolution. It's not possible to do a double-blind placebo-controlled trial and to show that this is correct. But there's a lot of evidence for that. There's particular evidence for cognitive reserve that the more we use our brain during our life at work and at home, the lower the risk of Alzheimer's disease. The concept of the reserves comes from reserves being held back in battle. So a battle will be joined, and some of the troops are not actually involved in the battle yet until somebody decides, okay, we need them, and the reserves are called in. This is our reserves, which includes our brain function of all the parts of the body, and our psychological and social interactions. I think this is maybe a difficult concept, but what we do influences our risk of the diseases, but also how we adapt to them. So it's not only whether we get something or not, but how badly it affects us. Imagine Roger Federer, great tennis player, if he had to carry a 50-pound pack on his back, his function would decline, but his backhand would still be better than mine. If I had a 50-pound pack on my back, my backhand would be much worse, much more impaired by the weight than his, because his reserve capacity would be very high. We have the same thing about our pulmonary function, liver, kidneys, oral health, and so on. And of course, the brain. Education and cognitive stimulating activities are protective against cognitive impairment. There's nothing magical about this. There isn't like something that you should do or other things you should not do. You should do things that involve learning. And if you enjoy doing crossword puzzles, you can do crossword puzzles. If you don't like to do it, don't do it. Find something else. Whatever it is. If you watch Seinfeld and you've already seen it and you know what joke is coming, then that's not learning. If you read a book and you fall asleep, the pages do not continue to turn by themselves. If you're watching television and you died, the television would be perfectly happy to go on and wouldn't be affected by the fact that you died. You want to have an interaction. Recent research on crossword puzzles shows that the down words are good for the brain. The crosswords are not good for the brain. That's a joke. Anybody? It's not sure. Physical reserve is the balance of all the body systems, including the gut bacteria. Oral health is just one aspect of physical reserve. Bacterial infections in the mouth are a risk factor for Alzheimer's, Parkinson's, and stroke. Research with my group in Japan have shown that brain hemorrhages can be caused by oral bacteria. So you can't, you need a blowtorch to remove the bacteria from your mouth. You can't do it, but you can balance them, you can control them. And what I say is, you can't remove them, but you don't want them to have a party. So so taking care of your teeth is good for the brain. It's also good for your teeth, but that's like something else. It's good, you should think of it as good for your brain. The health of the body is good for the health of the brain. It's not only the heart, but also the liver and the kidneys and all of it, involving blood pressure, diabetes, and so on. Our largest environmental exposure is the bacteria that live inside us. Everybody has maybe 1 or 2 pounds of bacteria that are alive inside the gut, mostly in the colon, but all over, in the mouth, and the throat, and the pharynx, larynx, esophagus, and stomach. And we have them all the time, from soon after birth. All of our ancestors going back 1 billion years had them. Every animal on Earth has them. A cow cannot digest grass. Termites cannot digest wood. They have bacterial partners. The nature of these bacterial partners are under our control because they are, the only thing they have to eat is what we eat. They eat our diet. And mother's milk has complex sugars that cannot be digested by the baby. And you think, well, that's ridiculous. Why would evolution produce this system where the mother is giving something to the baby and the baby can't use it? It's food for the baby's bacteria. That's an illustration of how important this is. So if you go out for dinner and you decide to have a big steak, you're not giving the bacteria anything to eat. This is an oversimplification, but it's basically true. If you instead eat a lot of peas and beans and brown rice and whole wheat bread and cucumbers and whatever, and greens, you're giving the bacteria a good meal, and they'll grow better and lead to more tolerance. They will tamper down the immune system, which may have a good contribution to Alzheimer's, Parkinson's, ALS, heart disease, and stroke, and cancer. And this is not some miraculous discovery I made. It's established. Like a high-fiber diet is good for colon cancer. I'm comparing it in this slide with a sneeze. So a sneeze is a significant exposure, especially nowadays, but it's a small exposure. It doesn't last very long. And there's a fascinating reason why this is involved in inflammation. Because these bacteria evolved with us, they evolved the capacity to make us accept them. Because if we didn't, everybody would have inflammatory bowel disease and we'd all be dead. So evolution allowed them to choose the ones through natural selection that help us tolerate them. And our evolution allowed them to be there because we need them, because without them, we can't live. We can't live without these organisms. We evolved with them, and they evolved with us. This is a form of symbiosis which is necessary for life on Earth. These interactions can occur via these pathways, from the gut to the spinal cord, or from the mouth to the brain, or from the nose to the brain. And we can control how this happens. And I believe this is a pathway for the initiation of Parkinson's and Alzheimer's disease pathology in the brain, that it goes from the gut to the brain. And we can influence this process by attention to our diet. Psychological reserve involves how do we pay attention? What do we pay attention to? Do we pay attention to sadness, regret, and stress? And how can we maintain healthy mental function and avoid agitation and unhealthy mental states? And people who are more stable are more resilient. And this is not, of course, that simple that you can go and enhance your psychological reserve. but it's related to this next one, which is social reserve, and it's related to how you pay attention and what do you pay attention to. If you pay attention to the fact that, well, I can't play tennis like I did 10 years ago, and what a tragedy that is. Or if I pay attention to the fact that I can still play tennis. I know a lot of people who can't, people my age who just, their knees are worse than mine, their elbow couldn't be repaired, or whatever it is. I'm not saying tennis is the best example for all these things, but if you pay attention to the opportunity part rather than the disability part, it might make a big difference. Or Mark Twain said, why are so many people suffering from tragedies that don't happen? It's my experience that most of the horrible things that you worry about don't happen. Most of the horrible things that happen, he had no idea this horrible thing was going to happen. Then finally, social reserve is our networks and interactions with other people and organizations. People who are married have a lower risk of Alzheimer's disease. People who are involved in groups are relatively protected. It's not good to be isolated, and humans are genetically or evolutionarily a social species. We are a social animal. It's a big problem, let's say, in retirement when people are active at work and have friends at work and go out for lunch at work and they have tasks and they have meaning at work, then they retire and they've lost all of that. That's a big loss of psychological and social reserve. The most important book I have ever read is this one by Viktor Frankl about man's search for meaning, that everybody can enhance their psychological and social reserve by seeing what they can do to find meaning in their life. Meaning can be from what you do at work or what you do in your hobbies or groups with other people, or your ability to survive and maintain a good, healthy mental state despite your suffering. Going to the second section of the book, applications, they involve recommendations for physical activity, health of the whole body, mental activity, some psychological measures, social factors, how to deal with stress and sleep, and so on. I can't say which of these applications are better for which of these four reserves, because all the reserves are interacting. If I have a patient who, let's say, she used to play the cello, but she stopped. Her husband didn't like it when she played, so she stopped 40 years ago, and now he died. And she's depressed, and she comes to see me. I find out she used to play the cello. I say, well, why don't you play the cello again? Of course, it's not that simple. She's just not going to play it and be a virtuoso, but she could study it. And that's good for the cognitive activity. There's a physical activity. Maybe she'll take the cello and go to lessons. That's a physical activity. That's also a social activity. And it's a good thing. To make music is good for your brain. And maybe she'll be part of a group. Maybe she'll be playing in the orchestra. I was interacting with one orchestra, and I met this 85-year-old woman who was playing old-fashioned cello, Baroque, viola da gamba. And I wanted to take a picture for a talk like this 30 years ago. I said, would you mind if I take your picture? She said, oh, please take my picture. And could you send it to me? I want to show my grandchildren I'm playing in a real orchestra. And then she said, oh, I got to go. And she put her little cello in a backpack that somebody had made for her just to hold it. And she went running off to her next meeting. So this showing the interaction of all the four reserves. I have written prescriptions to patients. Play the piano. That's my prescription. So we can do gene therapy in the kitchen, by which I mean changing human genes is very difficult. It's possible in some cases, but it's hard. But most of the genes we have in our body are not human genes, they're bacterial genes. And if we change our diet in a period of as little as 2 weeks, we can change the nature of the populations that reside in the gut. And this can be good or bad. So if you decide to go on a high beef diet and eat bacon for breakfast and hamburgers and steak, a steak has no fiber. Meat has no fiber. It doesn't have nutrition for the good bacteria. Fiber is the part of the food that we can't digest, but the bacteria can, and they ferment it and they make molecules that help our immune system be more relaxed. I can give you the molecular mechanisms of that, but I'm not sure it would help. So I recommend these things. I would point out that the summary of this is plants. Our ancestors ate meat, but they ate meat only when they were successful in hunting. And they did not eat beef because cows did not exist. Of course, they were buffalo, but buffalo are more active animals than cows. I mean, a cow in the African savanna would not do very well against a dog, because it can't run away. So cows have 5 times more fat than game, saturated fat. These things are generally good. These things are generally not good. It's said by the historian Yuval Harari from Israel that more people are killed by Coca-Cola than by Al-Qaeda. Sugar is not good for you. I mean, it's okay to have sugar, it's a question of how much. But Coke and Pepsi, they have an enormous amount of sugar. Or Gatorade. And artificial sweeteners change the gut bacteria in a bad way, so you don't want to have artificial sweeteners either. Having a high salt diet enhances the immunity, enhances the aggressiveness of the immune system in a bad way, which again doesn't mean you can't have salt, but you shouldn't have too much. And you should avoid sodas, and fruit is better than juice, because juice has no fiber, and fruit is very, very filled, has a lot of fiber. And he also said sugar is more dangerous than gunpowder. This is a good example. Diabetes is related to the gut bacteria. There are people who have diabetes who can fix their activities and their diet and not have diabetes anymore. Not everybody, but diabetes is not just a genetic thing, or it's not just something horrible which happens to you and then there's nothing you can do about it. A high-fiber diet is good for diabetes. I mean, good for patients who have diabetes. Meat occupies space on your plate, which could be better occupied by something that was good for you. So even if you're having a burger and peas and rice, you may think, oh, well, I'm eating peas today, that's good. The burger is taking space up on your plate, so instead of that burger, if you had eaten eggplant or artichokes or all kinds of different plants, that would be better. Physical activity improves the growth of new neurons in the brain, and we all need some of those. It improves the production of growth factors in the brain, which is also good. But ownership of an exercise bicycle does not count as exercise. And it's not enough to have the intention of exercising. Many people, well, I intend to do it, but it rained. Or I intended to do it, but my cousin called me and we went out to the, So you got to do it like your life depended on it, because it does. And it's almost, very few people cannot exercise. Even if you're in a wheelchair, you can exercise with your arms. If you can't run, you can walk. Walking is very good. And if you can't walk, maybe walking in a pool called aquatic therapy is easier on your body than walking without the water, so that can be a way to have exercise even if you can't walk. Ramon y Cajal, the great Spanish neuroscientist, said the cortex was a garden full of an infinite number of trees. The nature of these trees is dependent on what we do. So the more active our learning life is, the more we have better trees. And the more resilient we are to something which might happen when we get older. It could be Alzheimer's disease, could be stroke, could be head injury. We're more resilient if we have better trees. It's good to exercise in nature when that's possible. And it's just funny that in the book, my first editor read this sentence in the book about exercise in nature, and he said, consider deer hunting. Deer hunting. And he was saying, okay, all right, if you want to increase your mental fitness, consider killing animals, which is not, I removed that sentence. Luckily I noticed. It's always good to have healthy relationships with others. And taking too many drugs is an enormous problem. It is the commonest cause of treatable, reversible mental impairment in older people. Tylenol PM has Benadryl, which is anticholinergic, which damages your memory. So we have many patients who they take Tylenol PM because it's bought over the counter, so people think it can't have any bad side effects because you don't need a prescription. But if you take it every night for a few weeks, you can get significant memory loss. You can even have car accidents if you drive to work in the morning after taking Tylenol PM. This response is variable from person to person, but there are a whole list of 100 different drugs which can have this effect. The ability of the liver to detoxify alcohol declines with age. So I had a patient who was 94 who was drinking too much, and I told him, "I'm sorry, Mr. So-and-so, but your liver is 94 years old. So he shouldn't assume it could work as well with the same dose as he had when he was 40, 50, 60, and 70. Meditation is basically practice in paying attention. And as I said, attention is a critical thing here for memory and judgment and learning. And attention is intrinsically joyful. That's why people climb mountains, because it enhances their attention when they're hanging over the edge and looking over, a 4,000-foot fall. They're not thinking about anything else. So meditation is practice in not thinking about other things. And it helps us choose one thought over another. And there are many ways to pursue that. And you may be surprised to know, this could go in a press release, evolution has developed good mechanisms by which the brain can be protected from multiple blows to the head. In woodpeckers. Evolution has produced mechanisms so the woodpecker can do this all day long, literally for millions of years, and not get brain damage. But it does not apply to humans. Humans are not protected from that. Football is very bad for the brain in childhood and in adolescence and in adults. And I'm embarrassed to be part of a university that has a football team. I don't think it's a safe thing for students to be doing. And the brain is not the only part of the body which gets damaged. It's key that medicine must be personalized. Francis Collins developed the concept of personalized medicine, which is that the medicine in each patient should be based on their genes. And that's a good idea. I'm all behind that. However, personalized medicine is what every doctor should have been doing 100 years ago. Every doctor should be doing that now. And the key to the 4 reserves is personalization. So I can't ask a patient to play the piano if they never did play it before. But by learning about them and by everybody exploring your own interests, activities, and skills, it'll help you to see what should be done, what can be done. It's the key thing about the multiple reserves, not only the genes. And the key concept here is diversity. Diversity of diet, diversity of activities, and diversity of contexts. So you want the bacteria in the gut to be diverse because that's better for your health, and it's more like what was present in our ancestors 50 and 100,000 years ago. But in order to have diverse bacteria, we have to have a diverse diet. So regardless of how much you like broccoli, I don't recommend eating broccoli every day. Eating broccoli one day and kale and then mustard greens and all the different good things, but varying good things. Not a friend of mine at Tufts, professor of nutrition, he was obsessed with blueberries. This is 15 years ago. He ate a pint of blueberries every day. And he thought this was good for him. But now we know it would have been better if he had blackberries and raspberries and whatever other kind of berries, also bananas, and that would be better. Walking is good, but consider lifting weights, stretching, all of the diverse activities. It's interesting to see how everything I talked about opportunities are unequally distributed in the population. Poor people have less access to health care, so their physical reserve could be less. They have more hypertension. They might have trouble affording drugs. Education is less available to poor people in this country, particularly in Kentucky, where the funding of secondary schools has declined every year for the past 7 years. And higher levels of education are good for cognitive reserve and is a protective factor against decline. Every health condition is relieved or is helped or is lower risk of every health condition in people who are more educated. So it would be a very reasonable idea for society to facilitate education in every possible way, which would have enormous benefits on health and fitness. In conclusion, I'd like to go back to the ship. The ship could represent our understanding that aging is not inevitable, that we need to have a third goal regarding maintenance of fitness, taking care of your cells, and paying attention to all aspects of the ship, and recognizing that aging is an opportunity which doesn't happen to everyone. And I just happened to look up the word opportunity in the dictionary, and I saw that it comes from Latin, and it means a favorable wind coming to port. That's where the port comes in, opportunity. And I think it's a lovely metaphor for aging, that we're coming into port, and we have a ship, and you can't get there if you don't have the right wind. And you have to treat the wind. You have to deal properly with the wind. And we need to take advantage of all the favorable winds, especially those that help us to age well, because it makes a difference of what we do. So thank you very much for your attention, and I'll be very pleased to answer your questions.
So we have a little bit of time. If anyone has any questions, this is the microphone right here. We have, let's say, 15 minutes. If you have questions, please come on up and ask.
Hi, I'm
Hi.
91 and a half, and I'm very curious to know how old you are. What can I say?
I wrote it down here somewhere.
Are you pleading the 4th or the 7th or whatever it is?
73.
Thank you.
Thank you.
So
Thank you.
I do have a serious question. I have macular degeneration, and there just seems to be nothing that I can do except exercise, eat healthy, and take my eye vitamins. Do you know anything else about that?
I don't know. Macular degeneration has an inflammatory component. So I would ask your ophthalmologist if there's any aspect of diet that influences that. And he or she may say they don't know. But you could do research by looking and Google the word macular degeneration in quotes and then diet. And it would tell you, it might give you 10,000 papers or 10,000 references. But this is a new area. And I'm not an ophthalmologist, so I don't know, but it's possible that people are doing research showing that the fiber content of the diet helps to limit the inflammation in the eye. I don't know.
Okay, thank you.
Dr. Sheth.
Thank you. There were several references about moderation in alcohol, or alcohol is bad. So for some of us who do like their wine, what is adequate or safe amount of alcohol?
Right. Well, thank you. The recommendation of the, I think, I don't know if it's the Heart Association or a large group of doctors. 1 drink a day for women and 2 for men, and 1 is defined as maybe 2 ounces of bourbon or spirits, or 1 beer, or 4 to 5 ounces of wine. And men could have 2, and women could have 1. However, there's recently a large study showing that it's not clear if you're healthier if you drink than if you don't drink. But a general conclusion, which most physicians agree with, people who don't drink should not start. And people who drink too much should drink less. So there are 10 reasons why alcohol is bad for the brain. But it is generally believed, like for a woman, 4 ounces of wine a day is fine. One complication is a wine glass is this big. If you fill it to the top, that's probably 8 ounces of wine. Maybe that's too much. Thank you.
I know somebody do the alcohol and the drug for many years. So they have addiction, very hard addiction. So maybe you are professionals, you know how to deal with the addiction, drug and alcohol.
Well, addiction is an enormous problem around the world. And I think it's related to genes, but I don't know how. And I think people with addiction need to understand the opportunity they have, since they haven't yet died. They haven't yet had an overdose. And part of this is information. So I don't know if young people particularly, who use drugs, know that nobody knows what's in whatever they're taking. It was not produced in a lab. I mean, it was produced in a lab, but not by professionals. So one day it could get them this high, another day it could get them this high, and then a third day it could get them so stoned that they have a hemorrhage in the brain because the dose of whatever the active agent is 10 times higher, because nobody's controlling the quality. So they should be taught to fear the danger. My suggestion for this is every kid in high school should be required to spend a certain significant amount of time in the hospital taking care of these people, changing their diapers, washing them, helping them change the bed, so they see what happens, because many people grow up and they have no idea. They may watch TV about somebody died or somebody had a stroke or something, but they don't know what it's actually like. I think it would help for them to know and experience it themselves.
Second question. We are senior, somebody take a prescription for vitamin D or multiple vitamin. We know vitamin D come from outside the sunshine. So maybe you can give a suggestion, maybe we can take a vitamin D or go outside at least 20 minutes every day.
Yes, it's good to go outside. It's good to have sunlight. It's good for your brain. It's good for your vitamin D. However, you can't depend on that for your vitamin D. 70% of people in North America are deficient in vitamin D. And vitamin D is important in immunity and metabolism. And immunity, obviously, is very important. So that I recommend everybody take 2,000 units a day of vitamin D. And I check the vitamin D level of every patient I see. I also recommend B12 because it's very important in the brain. And many people are not good, many people like me, we don't absorb vitamin B12 very well. And I need to take an enormous dose so I can get my level up high enough.
Thank you very much.
I heard you mention in diet that sugar is a very dangerous thing, and I heard you mention fiber a lot. Just some quick points on diet. What do you recommend in terms of proteins, those sort of things, and is there a quick and dirty way that you look at that health-wise?
Well, thank you. You can get protein from plants, and you can get it from fish. Fish is better than chicken, and chicken is better than pork and beef. Okay. And plants have protein. And what was your other question about? Well,
you mentioned fiber quite a bit, and that meat didn't have fiber. Do you eat meat yourself, or is that a treat for you? Is that?
I used to eat all the bad things you could imagine, but for the past 10, 20 years, I don't eat red meat, but I eat chicken. I'm trying to eat less chicken and more fish. Okay. And more vegetables, so that a good way to remember this is okay you don't have to eat meat for breakfast, you don't have to eat meat for lunch, you don't have to eat meat for dinner. You can have a perfectly adequate meal without meat.
Yeah. Thank you.
Thank you so much for the wonderful and enlightening talk. My question was that you mentioned the importance of engaging learning activities which engage the brain. Where do you see drawing a balance between that with activities which are more mindless, which allow the brain to go into default mode, network, and relax? So where do we find that balance?
Well, you need to have a balance between learning and relaxation. Mm-hmm. And a meditation is an opportunity for the brain to turn off. Not really to turn off, but for the endless thoughts to settle down. And it helps very much to enhance your thinking for the rest of the day if you spend some time in meditation, or it could be quiet relaxation, or listening to music, or going for a walk without talking on the phone to your accountant as you're walking.
Got it. Thank you so much.
Thank you. Okay.
Yeah, absolutely. So the question was that he mentioned rightly so, like the importance of engaging in learning activities. So my question was, how do you balance that with relaxation exercise? Is there any benefit of just allowing the brain to wander? And so the answer answered my question.
Did you hear Jaya? Okay, Dr. Ali?
Yeah. I am at the beginning of my 50s, but I feel still I have the same feeling when I was 40 and 30. So having this feeling is a kind of selfishness, or it will help me in long term that I'm still young. So I am guessing even at 60, I will have the same feeling. So even sometime when I go to buy something, I choose something which it is for somebody not in my age. My wife asked me, oh, this is not for your age. So having this feeling psychologically, it will help me, or it will be against me.
I'm afraid that the feeling may be a delusion. I was playing tennis, and my opponent hit a ball over there, and I'm running, and I'm thinking, I can get that. I can get that. And then I fell down to the ground, and I thought, why did I think I could get that? I haven't absorbed the fact that I'm not 19 years old anymore, right? So it's natural for people to embrace the idea of youth, and somebody could be really significantly impaired and think they're really in great shape. I have friends who are physicians and professors, and they're very happy with their very poor diet and lack of exercise, and they feel that they're really good. So I think this feeling that you're really it's nice, but you can't depend upon it.
Okay. Thank you.
Thank you.
Hello,
Luis.
Dr. Friedland. So you mentioned about a case of where somebody says, since I'm old, I'm just gonna eat whatever I want because I enjoy it the most. And that is true. We do enjoy the most unhealthy food, and that's related to the reward system in our brain, right? So don't you think there's like a discrepancy, like an adaptive discrepancy between what we enjoy and what is good for us? And how can we learn how to enjoy the healthy food more than the unhealthy food?
Thank you very much for that question. Thank you. It's possible to educate the brain. So when I stopped, and maybe other vegetarians or fish vegetarians or whatever vegans can comment, but it was hard to stop eating meat because it's very appealing. But if you don't eat it for a while, it's really disgusting. It's a cadaver. So the steak is a cadaver of a cow. Why would I want to eat a part of a dead cow? And so your tastes change. But another very important concept in your question is our experience entirely depends not only upon the experience itself, but upon the background. So I was in clinic one day recently, and I didn't have time to eat lunch. And at 3 o'clock, I had a moment, and I had an apple, and I ate the apple, and I think, oh, wow, what an apple. This is delicious. Where did I get this apple? It tastes better than any apple I'd had in years. And it was the fact that I was hungry. Normally, when I have lunch, not only in clinic, not only am I having lunch, I had a snack at 10 o'clock, maybe and a snack at 11, and then I'll have a snack at 2 and at 4, and by the time I have dinner, I'm hungry, but I'm not really that hungry. So the most delicious thing to drink in the world, undoubtedly, is not wine or or Coke or whatever, the most delicious thing is water. If you're really, really hungry, you want to drink water. So the quality of all our experiences depend on the background, so that a practical application of this is, I used to put sugar on cereal. I find it impossible to have oatmeal without sugar. So now I put raisins. Raisins have fiber, and they're sweet. And it's not exactly the same as sugar, but it helps. So it provides a balance, and it's helpful to consider the background of your experience and not only the experience itself. Yes?
Would you speak a little bit about the impact of media when we're consuming TV and news and movies, and how that might affect the brain?
Thank you. So with my colleagues in Cleveland, we wrote a paper on television, and we found that people who watch more television have a higher risk of Alzheimer's disease. We didn't think television caused it, but we thought watching television is a marker of an intellectually inactive lifestyle, which doesn't mean it's possible to watch David Attenborough and learn things about hyenas and so on. That's good, but most people are not watching those things all the time. They're watching trash. And television is actively encouraging you to not participate. So it'll have an ad, and it'll say, oh, stay tuned, 9 o'clock tonight, there's a new movie. And then they'll show a woman screaming for half a second. Then they'll show some man falling off a bridge for half a second. And then another person being attacked with a knife and for half a second. And the brain cannot process information that fast, cannot process visual stimulation that fast. So all the brain could do is turn off, stop paying attention. So the brain, TV is actively encouraging you to don't be there, to not really be there. At the same time, it's trying to convince you that in order to have a good time, have a good relationship with like a girl, you have to drink beer, because those people are really happy when they drink that beer. And it's quite toxic and has a bad influence on the brain. Thank you.
So most of your talks have been about like people that are over like 50, but as you can see, I'm not that old. So is there anything that like people that are young can do to help with the future?
Yes, thank you very much. I would say don't overutilize plastic, which is bad for the environment. Avoid all sodas. Gatorade has too much sugar. It also has artificial color, artificial flavor, and artificial sweetener. And some of these products are known to cause cancer. It's good to be active, but it's good to be active. It's good for children to be active in a way which leads to activity through their life. So if you play football, you're not going to play football when you're 25. Nobody plays football. The chance of being in the NFL is very, very small, even for the best high school football player. So the chance that they're ever going to play football when they're over 20 is close to zero. If you learn football, you're not learning something which is going to help you get to be 80 years of age. If you play golf or track and field or tennis, it's something you're learning which can help you for a lifetime. It's good not to eat too much meat. And with an epidemiologist from Cambridge, I wrote a paper 14 years ago, what should the pediatrician know about Alzheimer's disease? And it went into this concept exactly just as you asked. And the question is avoiding injuries, learning things. So learn not to watch television. That would be a wonderful thing. I don't know the data, but in America, children, you can get rid of the children by go, don't bother me, go in there, watch television, and it's not good for the brain. I'm sad to say this paper I wrote 14 years ago has never been cited once. There was nobody in the world of pediatrics who was interested in what they might do in childhood that leads them to help. So head injuries in soccer are not good for the brain. And football is even worse. So I hope you're not planning, you're not going to be a football player. Thank you. Yes.
ちょっとよろしいですか？私は日本語で質問します。英語ができないから通訳をあなたの知ってる柴根さんにしてもらいます。
So I'm going to ask a question in English, in Japanese, because I'm not very fluent, and I'm going to have somebody you know interpret for you.
Okay. Arigato.
アルコールは脳に悪いって聞きましたが、一つぐらいはいいことがあるんですか？どこに行ってもアメリカではハッピーアワーがあってアルコールが出るんですけども、そこをちょっと聞きたいです。
So you said alcohol is not very good for the brain, but I'm wondering if there must be some good in it, because in the United States, wherever you go, there seem to be restaurants seem to have happy hour. So what are your thoughts on that?
Alcohol does relax stress. At a certain point, it provides relaxation. At a different point, it provides agitation and violence. It should be known that alcohol is directly toxic to the brain. If you drink too much, you tend to have poor nutrition. Alcohol damages the nerves, it damages the liver, and it impairs your physical resilience, or your physical reserve is impaired by drinking too much. And it's also addictive.
もう一ついいですか？
One more question.
私は日本人で、日本にいる日本の人はお魚とかお肉あんまり食べずにいいものを食べてるから長生きするって聞いたんですけど、私はアメリカに住んでるからピザとか何でも悪いものもいっぱい食べます。その辺の寿命はやっぱり違ってくるんですか？
Okay, in Japan, people eat healthy, like they eat fish and lots of vegetables. But since I've come to the United States, I love to eat pizza and fast food and junk food. Do you feel my lifespan would be impacted by that diet?
Yes, it's okay to eat pizza, but not too frequently. And junk food is not good for your health. And the best advice from Daniel Pollan, I think was his name, he said, eat food, mostly plants, not too much. So processed food is not food. It's imitation food. McDonald's, all of it, it's imitation food. It's not good for you to have Doritos, corn chips, all these things. They're manufactured. We evolved on Earth eating food, not this artificial stuff, and it's not good for our reserves. Thank you. Can we have another? Thank you.
Real quick.
Thank you.
You say raw sugar is bad. How do you feel about raw honey?
Raw honey?
Yes.
I understand all sugars are the same. That honey and refined sugar are equally not good. And babies should not have honey for some reason. But otherwise, I think honey is fine. Maybe, and some people think it tastes better. But if you bake a cake with honey, you can't say that it's better for your health than if you had baked it with sugar.
Coffee every morning.
Yes, so to sweeten your coffee with honey is the same as sweetening it with refined sugar.
Yeah. Okay, that's cool. Thank you.
Susan.
Excuse me. Hi. Very, very good talk.
Thank you.
I enjoyed it, and also I've gotten into your book, and everybody should buy it.
Thank you, Susan.
I've got a question about children and their diets, because they are going to get older. How do you feel about children who are vegetarians? I'm talking about under 10. I have a granddaughter who says, I'm a vegetarian, and she doesn't eat meats.
That's a good question. I would hope that she eats a lot of tofu and other kinds of beans, and that her pediatrician is informative enough to give her specific advice. Like, does she eat dairy?
Does she eat dairy?
Does she eat milk?
Yes, I think she does drink milk.
So milk and cheese has protein.
Okay.
And I think she could be fine and grow up very well even without eating meat.
Okay. I
But
mean, they don't seem to be concerned that she is a vegetarian.
But her B12 level needs to be measured.
Mm-hmm. Okay. B12.
And one problem is a lot of doctors don't know anything about nutrition. So in my medical school, I don't think they had any lectures about nutrition. Was not the idea that Hippocrates, who said food is the best medicine, that idea didn't reach us until recently.
Right. Not all food, right?
Right.
The other question, what about all of this social media, this, all this technology that, is sort of being forced on us?
Yes.
We have to go in that direction, but what about for young children and their brains and, as they age?
Well, that's a wonderful question. Thank you. Thank you. Randolph Ness is a scientist in Arizona, co-founder of the field of evolutionary medicine. He says we suffer from social obesity. That is, we spend too much time with social media, and I think social media tends to be very destructive. What do you see? You see real life. You see, oh, my friend George is in Paris and with his wife, and they're drinking wine near the Eiffel Tower. Well, good for them. Okay, my friend here, his dog is having a birthday. Do I need to know that this guy this professor of epidemiology in California has a dog with a... It's pointless. And usually the content of the message is, look at me, look where I'm traveling. Oh, I bought a new bicycle. Oh, I bought a new car. Look at my new car. Look, I'm on the beach in Mexico. No, you're not. So you don't have to do it. And I'm sure it's more destructive for children.
Possibly their brains for the future, too. Thank you so much.
Jaya has a question. Jaya, please.
Children are constantly bombarded with all kinds of games, all kinds of, even in educational activities, there are too many things coming at one time. Does that affect the brain, and what happens to that brain when it gets older?
Well, that's a very good point. I should have mentioned it. Attention needs to be unitary. You can pay attention to one thing. You can't pay attention to two things at the same time. So if you are a co-pilot on a flight and you're landing in a storm in a difficult airport, you don't tell the pilot controlling the plane, did you see what happened in the market today? Wow. Or did you know there are 258 women in this flight and only 125 men? So humans are not good at multitasking. Some people say it's impossible. All you can do is shift your attention. A computer can shift its attention like almost infinitely. It can do 10 things at once, and I don't know how it does it, but we can't do that. I can't have a conversation with a student over here while I'm typing a note about a patient. I can't. I thought maybe I could use one hemisphere for this, and it doesn't work that way. You can't do it. So children should know the value of focusing their attention, and it's the best way to learn.
My granddaughter is listening to music with her thing while she's studying. How is that going to work?
Children can do that better. When you get older, the ability to do that is diminished.
But my point is, every child is tempted with listening to music while studying or doing something else while something else. So maybe they should be, when it comes from parents or grandparents, it doesn't work. Maybe they should hear it in some way from somebody that will...
Yes, they should consider the possibility that it's decreasing their performance. Yes, and the related thing, which I didn't mention in regard to Yasha's question, is sleep. Sleep is necessary for memory, Sleep is when our memories are made. Sleep is just not, a passive question about your imagination and dreaming. It's important for memory. So children need to know that their sleeping is helping them learn. So when I was in high school or college, if I had a test, I'd stay up until 3 o'clock in the morning studying before the test. That was a bad idea, which I didn't understand at the time. I would have been better off going to bed early and getting more sleep. And children and parents should know that enhancing their sleep is in helping their learning.
Is there any of some innovative way to make the parents understand, but some way to get to reach the children?
I don't know. Maybe through the teachers would be the best way.
Thank you very, very much.
Thank you.
Thank you. Yes, yes.